Do you have the ability to recognize medical emergencies and respond appropriately? Medical emergencies may be the result of accidents or sudden illnesses. Heart attacks, stroke, diabetic emergencies, choking, automobile accidents, and gunshot wounds are all medical emergencies. Falls, burns, cuts can also be emergencies when they are severe. When you come upon an emergency situation, it is important to remain calm. Act quickly and communicate clearly. Memorizing the following 6 steps will help you respond calmly and quickly in an emergency. First, assess the situation. Try to determine what has happened. Make sure you are not in danger. Notice the time. Second, assess the victim. Ask the injured or ill person what has happened. If the person is unable to respond, he may be unconscious. If the person does respond, use his account along with your observations when you talk with emergency personnel. A person who has been injured or has suddenly become ill may not know or remember or maybe be too embarrassed to say exactly what happened. Number 3, get assistance. Most emergencies will require that you or somebody nearby call for emergency assistance immediately. Follow your agency's policies for whom to call under what circumstances. Always have an emergency phone list near the telephone. Next, do no harm. Make the injured person or ill person as comfortable as possible. Moving a person who has had an accident can make an injury much worse. Do not move the person unless he is in danger if he remains where he is. For instance, in the case of a fire. Never perform life-saving measures unless you are sure the person needs it. Never perform life-saving measures unless you are trained to perform the procedure. Next, provide comfort and support. If the injured or ill person is conscious, he may feel panic about his condition. Listen to the person and tell him what actions are being taken to help him. You must maintain a calm, confident manner to help reassure the injured or ill person that he is being taken care of. Next, report according to the agency guidelines. Once the emergency is over, you will have to file an incident or accident report with your agency. If you know in advance what information you will need to know to complete the report, you will be better able to remember important facts. Documenting emergencies accurately is very important to you and your agency. How can you assess a person involved in a medical emergency? Well, the most serious medical emergencies involve one or more of the following. The person is unconscious, the person is not breathing, the person has no pulse, or the person is bleeding severely. To determine whether a person is conscious, tap the person and ask if she is all right. Speak loudly and use the person's name if you know it. If they are unconscious, call for help right away or send somebody else to call for help. After calling for help, return to the person and check for breathing, pulse, or severe bleeding. Following these steps. Number 1, check for breathing. Look for the chest to rise and fall. Listen for sounds of breathing and feel for the person's breath on your cheek. 2, check the person's airway. Tilt the head back slightly to open the airway. Next, check for breathing again before checking the pulse. If the person is breathing, she also has a pulse. Next, check for pulse by feeling the carotid artery in the neck. Determine if there is a pulse. If there is no pulse, make sure help is on its way. If the person has a pulse but is still not breathing, she may have inhaled or choked on something. Check for severe bleeding. Look up and down the person's body. If the person is bleeding, or if you see a significant amount of blood on the person's clothes or on the ground, make sure that help is on its way. If a person is conscious and able to speak to you, she is breathing and has a pulse. Talk with the client about what happened and check the person for injury. Symptoms to look for include severe bleeding, changes in consciousness, irregular breathing, unusual color or feel to the skin, odd bumps or depressions on the body, medical alert tags, or anything the client says is painful. If one of these conditions exists, you may need professional medical help. Follow your agency's guidelines and policies about whom to call in different situations. If you need to call emergency services, call 911 or dial 0 for the operator to get emergency medical services. If you're alone, make the call yourself. If you are not alone, shout for help and have someone make the call for you and then return to you. When calling emergency services, be prepared to give the following information: the phone number and address of the emergency, including exact directions or landmarks if necessary; the person's condition, including any medical background you know; your name and position; and details of any first aid being given. The dispatcher you speak with may need other information or may want you to give other instructions. Do not hang up the phone until the dispatcher hangs up or tells you to hang up. If you are in a home, unlock the door so that emergency personnel can get in when they arrive. If the person is breathing, has a normal pulse, is normally responsive, and is not bleeding severely, you may not need to call for emergency services. If a client has fallen, been burned, or cut himself, but the damage seems to be minor, call your supervisor. Let the person answering the phone know that you are with the client and an accident has occurred. Later, you will need to document the emergency in your notes. Try to remember as many details as possible and remember to report the facts only. If a client had a heart attack, your notes should record the signs and symptoms you observed and the actions you took. Knowing the kind of information you will have to document will help you remember the important facts during the emergency. For instance, it is especially important to remember the time a client becomes unconscious. Emergency evacuation procedures. If a fire or other disaster occurs, you may need to get yourself, the client, and the client's family members out of the home immediately. Leaving in an emergency is called evacuation. Because you may not have a lot of time to think or plan in an emergency situation, you should know how to best evacuate each home you work in. You should plan for evacuation by doing the following. First, locate all the doors and windows that could serve as exits in an emergency. In an apartment building, know where fire stairs are located. Elevators may be unsafe in an emergency. Know the location of disaster supplies if they are available in the home, including a fire extinguisher, ladders for escape from upper floors, first aid kits or supplies, and utility shutoff points. Discuss a plan for evacuation with your clients and their family members. Emphasize that everyone should keep calm in an emergency. And finally, agree on a place outside the home for everyone to meet after an evacuation. Do you have knowledge of disaster procedures? Disasters can include fire, flood, earthquake, hurricane, tornado, or severe weather. The disasters you may experience will depend on where you live and work. If you live in an area that is prone to disasters, call the local chapter of the Red Cross to learn more about how to prepare for and handle disasters. Know the policies of your agency concerning local disasters. There may be specific instructions for different geographical areas. For instance, designated shelters to go to. The following guidelines apply in any disaster situation. Remain calm. Listen to the radio or television bulletins to keep informed. A battery-powered radio will allow you to stay informed if the power goes out. If a disaster is forecast, for example a tornado or a hurricane, be ready. Wear appropriate clothing and shoes, and have family members dressed and ready in case of evacuation as necessary. Stay in contact with your supervisor, or others if possible. Let someone know where you are, what conditions you're in, and where you will go if you must evacuate. Locate disaster supplies. Ideally, a disaster supply kit should be assembled before the disaster strikes. Emergencies and disasters are things that hopefully don't arise very often, but when they do, you need to be prepared for them. The more work you can do ahead of time to prepare your environment and yourself for the possibilities, the less likely you will have of having a tremendous amount of stress when they arise. Study this information and put it to practice.